Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. And today we continue our discussions around the COVID-19 pandemic. As usual, if you have any questions, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Today, I start off, as usual, wearing my mask, and it's covering both my nose and my mouth. Any other way of wearing the mask is useless. And I want to say a couple things about the mask. And one major question, is it 100% effective? There's nothing in the COVID-19 pandemic that is 100% effective. Even the vaccines developed under the most modern conditions have a 95% effectiveness. But we still have to do what we can, because without making any effort, we have no chance at protecting ourselves. At least when you wear the mask, there's credible evidence that suggests that if you get exposed to COVID-19 virus, it will be in small amounts. And perhaps those small amounts can actually serve as a little primer for your immune system, almost like a natural vaccination. So wear your mask. It will reduce your exposure risk, and it is best to wear it the proper way, covering both the nose and the mouth. For the remaining time of our discussion today, I will take my mask off using the straps. There's no one near me to put me at risk, and I'm not putting anyone else at risk. We want to continue our discussion. It's 2021, and the hottest thing in the COVID-19 pandemic are discussions around the vaccine. Lots of concerns, lots of excitement, lots of expectations. Just to answer some of those questions and to shed some light on those, we want to find out who are the people that should be vaccinated. It's very important to know that, because it may not be readily available for everyone in the beginning. And when you do get vaccinated, what should you expect? Or even if when the vaccine becomes available in the country, what should you expect? And the biggest thing that people are discussing, those who have reservations about taking the vaccine, is what are the potential side effects? There have been lots of reports of things like Bell's palsy, people, one side of the face twisted and having a neurological problem, etc. There's also some reports of people getting the infection after being vaccinated, and those are not unexpected. The main major concern is if you have what is called severe allergic reaction or anaphylaxis. Essentially, if you've had an allergic reaction that required you to be admitted to hospital or receive intubation, etc., then you have a special concern about receiving this vaccine, and not just this vaccine, but any other vaccine. There's also a well-recognized occurrence in people who get vaccines, any vaccines, that things like Bell's palsy can occur. And like any other vaccine, it once given, and this is a 2-dose vaccine that we're talking about in COVID-19 pandemic, that you can still get exposed and become infected by the virus. But having the vaccine protects you from getting the severity and the need to get advanced interventions and getting into ICU and death rates, etc. That is the hope for getting the COVID-19 vaccine, that even if you do get exposed and you get the infection, the severity will be a lot less. So with that, let us look at some data that actually exists about the COVID-19 vaccine. If you were to look at people around the world what would be their attitude towards taking the vaccine, it shows that the majority of people would actually get vaccinated. And the question was asked, if a COVID-19 vaccine is shown to be safe and effective and is available, will you take it? About 46% of patients completely agree that they will take it. And 24 or 25% of patients said that they will somewhat agree to take it. So that gives us about 70%, 75% of patients. That's almost 3/4 of people will take the vaccine. There are some people, about 15% of them, who have no real opinion on it, but there's a small percentage of persons, 6.1% of people around the world, who have complete disagreement with taking the vaccine. And that's very important because we need to find out, what can change their mind, how we can get them to protect themselves. If not the vaccine, then what? And if they don't take the vaccine, will they be putting others at risk who are willing to take steps to protect themselves? So these are important questions, and it's public health questions. It's not a single person that is affected alone, but it can affect entire communities, it can affect entire regions and countries. How long does it take to develop a vaccine? Well, the usual time to develop vaccines is about 10 to 12 years. That is normal. But in the COVID-19 era, the vaccine trials from laboratory to human trials and usage have been cut down to 22 months at the highest, and as short as 11 months for vaccines to move from development to utilization. Even after these clinical trials are completed, however, vaccines will still have to be approved and produced on a large scale before they can be distributed to the general population. Very important. And it is important to note that every production, like everything else, has its limits and capacities. So let us look at the production capability for the COVID-19 vaccine around the world. And if we look at the USA, which has the largest capability of producing this vaccine, they can produce about 4.6 billion doses of this vaccine between 2020 to 2021. India about 3.1 billion, China 1.9 billion, the UK 951 million, Germany just over 500 million, and South Korea as well. Those are the countries that are actually capable of large-scale production of these vaccines. Now, if we look at the pre-production purchases by governments around the world for this vaccine, look at who actually purchased these vaccines. India by far has purchased the most vaccines, and this is even before production is completed. India has purchased 1.6 billion doses of the vaccine. The European Union 1.4, the United States just about 1 billion, Canada 358 million, United Kingdom, Japan, Indonesia, and Brazil. Notice on that list, you do not see any small countries. You definitely do not see any third world countries or countries that we share common heritage with, like the CARICOM bloc. So we are not in that group that would have pre-purchased a lot of these commercially available vaccines. We are dependent on the COVAX initiative, which is a WHO type affiliated initiative to get vaccines to poorer countries and the third world. So the main big vaccines from the Western countries that are in circulation right now are the AstraZeneca vaccine, which was endorsed and developed by Oxford University in the UK, the Moderna vaccine, the Pfizer, BioNTech, and the Russian Sputnik vaccine. Each one has their strengths and weaknesses, but each one has an effectiveness of about 90% or more. They all require some type of cold storage. The most severe of the lot is the Pfizer vaccine, which require cold storage of minus 70 degrees Celsius. That's not a commercial type freezer. That is a special medical grade freezer that has to be specifically purchased and developed for storage of this vaccine. One thing that the only one that has allowed the vaccine to be off patent and allow other countries to produce it once it becomes available is the AstraZeneca one. And that is encouraging for the rest of the world, especially poorer countries, because if there is mass production of this vaccine, then the cost becomes less and then the availability goes up. So that offers poorer countries a lot more hope so that we can actually access a high quality vaccine quicker than having to wait until the supplies are met for the larger countries before we ourselves get it here. When the vaccine becomes available, it will also have to follow a strategic rollout. Specific groups are supposed to get it as priority and before it actually reaches the general population. And we have to do that in a rationed, controlled manner because we do not have, or we will not have, enough doses for everyone in the beginning. And I believe sometime in the news, the first part of January 2021, we saw that we are expecting our vaccine stocks to arrive in the second quarter of 2021. That's still about 4 months away. So we still have to follow all of the safety measures that we've been told about, wearing masks, washing hands, social distancing, etc. I suspect curfew will still be in place, and all other public health measures that we can take to minimize our infection rate, our mortality, and morbidity. So if we looked at the priority allocation for rollout, in the stage 1 of rollout, we look at about 3% of the population. And that generally will be your healthcare workers and your social care workers. In stage 2, you hope to cover about 20% of the population. And that will include persons in the 65 and above age group and those considered high risk. And the stage 3 rollout will include an additional 20+% of the population, which include other types of priority groups. And these perhaps will include others who are part of their job and daily activity is mass interaction with vulnerable groups, etc. So that's important to understand that there is going to be, in every country that we can think of, at least in this part of the world, there's going to be a phased rollout of how the vaccine gets to the population in general. There are certain priority groups that have been identified, and if we were to prioritize groups from 1 to 8 where everyone gets vaccine in priority group 8, then we start off first with group 1, which is highest priority, which is the healthcare workers. And this is because healthcare workers come in contact with patients, including the nursing homes and first responders. The second priority group are those who are 80 years or more. The third priority group, 65 to 79. The fourth priority group are those with comorbidities. These are like diabetes, heart disease, lung disease, kidney disease, people on chemotherapy, etc. And of course, there's the fifth priority group is institutionalized people. Sixth, essential workers. These are your police, your soldiers, teachers, etc. The seventh priority group is over 55. And then the eighth and final priority group is the general population. So it's going to be an interesting rollout to determine how to manage this in the best way with your supply and demand. Why do people oppose vaccinations or the COVID-19 vaccination? There's some surprisingly common reasons. The first concern among people, about 25% of people have concern about safety. Another 21% are concerned about side effects. And a small percentage of people still believe that it is best to let nature take its course. And surprisingly, this is across several well-developed first world countries, Denmark, France, etc. And these are surprising data to come from countries like those. When we get our COVID vaccine here, I mentioned before, it will be given as an injection, usually in the shoulder, either right or left. You will choose which one you prefer to get it. And the things that you would look forward or look out for, common side effects. The uncommon ones we talked about earlier, but the common side effects, you may have some pain and swelling at the site of injection. You could always put some ice on that, or you could even take some Panadol, Tylenol, paracetamol. And sometimes persons can develop fever, chills, tiredness, and headaches. These are all common vaccine side effects, not just for COVID-19 vaccine, but all types of other vaccines, especially those that are injected. So I hope we would have discussed and learned a lot more about vaccines, and we're in a better position to have a reasonable discussion and understanding of the COVID-19 vaccine today. Remember, if you have any questions, feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again for joining me, and do have a wonderful 2021.